So before 2019, it was very difficult to categorize these patients into different categories because the clinical features were so overlapping and we were primarily dependent upon the lab testing reports. But after 2019, it became very, very simplified because there was a paper which was published in 2019 that was a clinical approach to identify inherited metabolic disorders. So after this publication, so it was extensive document, extensive publication, and in that publication they categorized these disorders based on the clinical manifestation. So nowadays, me with my team, we are able to identify these disorders clinically, and whatever diagnosis we are keeping, and surprisingly, we are getting that at more than 80 to 90% of time we are correct in diagnosing the patient. So, like a small molecule disorder, complex molecule disorder, and energy deficient disorder, these are three broad categories. But among a small molecule disorder, there are two categories. One is a small molecule accumulation disorder, and second is a small molecule deficiency disorder. So I will give an example. Small molecule deficiency disorders includes proline metabolic defect, glutamine synthesis defect, asparagine synthesis defect. So these manifestations, these are very important amino acids for a even brain development and the other parts of the body organ development. So whenever patient is suffering with these disorders, they have onset of symptoms in intrauterine life. So like serine synthesis defect patient can have a microcephaly at birth. And whenever we are doing that neuroimaging, we can find the malformation of cortical development with difficult to control seizures as a clinical manifestation. So then we can identify that this patient is probably suffering from serine synthesis defect, and surprisingly, it's considered as a treatable disorder. We just need to give a high doses of serine to these patients, and they show very good response to the treatment. So there are few case reports which are available online. So the patient which were identified at birth suffering with serine synthesis defect and treated, they had a very good neurodevelopmental outcome at the 6 month of age. So similarly, in complex molecule disorder, there are three different categories. First is complex molecule accumulation disorder. Second is complex molecule deficiency disorder, and third is cell trafficking and transport defects. So in this category also, we can identify them clinically. Like like complex molecule accumulation disorder, they present with the core spatial features, organomegalies. Complex molecule deficiency disorder, they have a different clinical manifestations. We can identify they present late, the chronic presentation, and like multiple exhaustosis. It's a GAG synthesis defect, glycosaminoglycan synthesis defects. And third categories is cell trafficking and transport defects. So these patients present with developmental delay, intellectual disabilities, movement disorders. So nowadays, with this classification, 2019 classification, we are able to identify these disorders on the basis of clinical presentation. But the problem is with the awareness, because the training of inherited metabolic disorders is not included in the medical curriculum in MBBS, even in MD courses. Now gradually these residents are developing interest in inherited metabolic disorder, but there are very few teachers across the country, those who can treat, those who can teach the students to identify these disorders.